I hope you are doing very well. So for today, my talk is going to be about medical fitness for work assessments. This is the outline of my talk, where I'm going to start first with some general background information. However, the main bulk of the talk will focus first on the objectives of fitness for work assessments, and then I will dwell a little bit on the principles that govern these assessments. And finally, I'm going to end my talk with a very brief summary. But before proceeding any further, let us first start with some definitions. And the first one is about health. So how is health defined? Although my dear colleague, Mr. Ahmed Al-Mamari, already defined it in the morning, but I'm going to reiterate that once again. So how do we define health? Is it simply the opposite of diseases or the absence of illnesses? Actually, it's not. It's much more than that. Your health is not only about the physical status of, it's not only the physical status of your health, but it's also related to your mental health, as well as having some relationship or some aspects of your social life. Accordingly, World Health Organization, WHO, defines health as a state of complete physical, mental, and social well-being. And it's not only and not merely the absence of diseases or illnesses. Along the same lines, let us define competency. What does it mean to be competent? Of course, a lot of you, especially the ones who took NIBOSH, already know the 4 factors which are involved in the definition of competency. And the first one is related to all the information and the knowledge that you gained over the years. And for knowledge, we have the letter K. And then, although all of these people are doing different activities, they are carrying out different tasks, nevertheless, they all share one main feature. All of them are able to do something. And here for abilities, we have the letter A. Regardless of how much information, knowledge, skills, or abilities you have developed over the years, we all need to attend events such as the one that we are holding right now, which is basically about continuous education and continuous training. And for that, we have the letter T. And finally, what's the difference between a fresh graduate and a more senior employee? Definitely, it's the years of experience, and for that we have E. Accordingly, competency is basically about knowledge, ability, training, and experience. So by now, we are ready to define fitness for work assessments, which are basically an evaluation of your health. As we said, it's not only about the physical health status, but also about the mental health, as well as the social aspects of your life. Besides that, it's also about assessing your competency, especially in terms of your abilities. Besides assessing you personally, fitness for work assessments are also about trying to ensure the safety of others, as well as trying to ensure the safety of the workplaces, property, and so on. In addition to that, fitness for work assessments also try to match between your abilities, your skills, and the reasonable and foreseeable job requirements. In many countries, fitness for work assessments are a legal requirement. Accordingly, neither organizations, nor objections, nor individual employees have the right to reject such legal requirements. Accordingly, if an individual either fails or refuses to attend a fitness for work assessment, what will happen next? You have all the right to declare them as unfit. Right now, we are all here at Crown Plaza. Where are we heading to? To fitness for work. But apparently, there is more than one route that can take us to fitness for work. What does that mean? It simply means that at present, there is no standardized approach for such assessments, which typically depend on your workplace as well as the country where you are living. So, The lack of standardization can obviously be both a blessing or a curse. It all depends on how you look at it. Coming now to the main objectives for fitness for work assessment, and the first one is to determine the baseline level for several parameters, such as for liver functions or kidney functions. Of course, abnormalities can be detected whenever these parameters go down, and this is what happens in a majority of parameters, but for some others, the levels actually can go up. It all depends on the particular parameter that you are looking at. Another main objective for fitness for work assessments is to identify the pre-existing medical conditions that a person is suffering from at present. The best example is the well-known group of non-communicable chronic diseases, including cardiovascular and chronic respiratory diseases. We have diabetes, cancer, and more recently, WHO also added mental health issues. So besides identifying these pre-existing conditions, we are also interested in identifying the vulnerable groups. What does that mean? People who are at a special risk. Examples of these people include extremes of age, such as elder workers, as well as pregnant employees and patients with special conditions such as asthma. Obviously, all of these groups of patients require extra care, and we need to take extra precautions. The last objective of fitness for work assessments is related to career change, whenever there is a change in work role. For example, an admin personnel might be interested to change his or her job and to become, for example, a warehouse operator or a forklift truck driver. So obviously, in such a case, they need to undergo a new fitness for work assessment since there are totally different health requirements for these two positions. So in brief, there are many objectives for fitness for work assessments, including determining the baseline levels, identifying pre-existing health conditions, looking at vulnerable groups, as well as trying to match between the worker and the workplace. Coming finally to the main principles that govern fitness for work assessments. And the first question that we need to answer is this: being fit for what? And the answer is, we need to be fit for the tasks that we are carrying out at present. We also need to be fit for extreme environmental conditions. A specific example is extremes of temperature. In relation to locations, it's not only about working in the desert, but more importantly, it's about the characteristic features of such remote locations, which include the environmental factors over there, aspects of social life, as well as either the presence or the lack of services at such locations. In order for fitness for work assessments to be effective and valuable, each and every party should play their roles effectively and completely. As for healthcare professionals, we need to try to provide the best possible medical care services, including carrying out full and complete medical examinations, requesting only the appropriate and the required medical investigations and tests. And consequently, we are going to be responsible about and accountable for all our medical opinions and the legal and ethical implications of our medical practice. As for employees, they are required to attend such assessments. As we said, they are a legal requirement. And if they are suffering from a particular health condition, they need to declare it, and they have to report their limitations. And whenever needed, they also need to seek medical help. In regard with the occupational history, we need to look at a lot of data, starting first with all the current as well as the previous employers for whom you have worked. We also need to look at the total duration of each job, the type of industry, the job responsibilities, and in regard with risk assessments, we need to look at the hazards at workplaces that the employees might be exposed to, as well as the control measures that are being utilized. Besides that, we also need to ask about the medical leaves that were taken in the past, especially because of occupational exposures, occupational injuries, or diseases. Coming to the investigations, medical tests, and here we first need to divide jobs into categories or groups in order to simplify the process. Once this is complete, then we need to target these specific groups of jobs. Therefore, these medical tests need to be job specific. And within each group of jobs, we need to apply all the investigations equally to all the employees. So there shouldn't be any discrimination or favorism for any employee. In addition to that, we should request only the required investigations and the most appropriate ones without ordering extra tests unnecessarily. In addition to that, if these tests were to be repeated, for example, in the future, in a short span of time, then the results need to be consistent and similar. And that is what we mean by having reproducible results. Coming now to periodic medical examinations, and here we have two main objectives. First, to utilize these examinations as a screening tool, where the subjects are still asymptomatic, i.e., they are not exhibiting any symptoms or signs at present. In addition to their role as screening tools, we can also use these medical examinations for the early diagnosis of such conditions before a particular mild disease progresses into advanced stages. Periodic medical examinations are considered to be an important component for continuous and proactive medical surveillance programs. Nothing is perfect. Similarly, medical examinations have their own limitations, which include they only look at one time point. Accordingly, they might have limited predictive value for the future. They are often not evidence-based, and they are affected a lot by cultural norms. There might be some wastage of resources, and there have been some cases of discrimination against particular groups of employees. So in summary, medical fitness examinations are an excellent and a very valuable tool if utilized effectively. These tests are carried out because of many indications. Teamwork is obviously extremely important in order to do a great job in such cases. And at the same time, we need to be fully aware of all the limitations related to medical fitness examinations. That's all from my side. Thank you so much for listening.